want to challenge this a little bit, just because I think in the integrative professional space, there's a bit of a continuum on this topic, and you know, there's things that are thrown around. If you don't test, you guess, implying that it's inappropriate to guess. You all are, I think.
We're not guessing.
You're not guessing, right? So I want to kind of hear a rebuttal to that. Why are you not guessing?
So that's the art of medicine, right? So that's why you go through all these years of training, and then you get out and you start practicing. And the more you sit with somebody, the more your knowledge grows and the greater your intuition becomes. So it's one thing like, I'm going to guess how many jelly beans are in the jar. That's a guess.
That is a guess.
When somebody comes in and you're putting together a whole series of clues, the more astute the clinician, the fewer the tests, because you're going to actually narrow down what is most likely going to happen. And that's why I said, you know, I just would have wanted to know more information before I subjected you to colonoscopy. I would have wanted to know celiac serology before I would have ordered a colonoscopy, right? So it's like, I think that there is an over-reliance on testing and an under-appreciation for the art of the interview, the art of history taking, and actually the art of clinical acumen and diagnosis. And when we're new in practice, we often order more tests, and the longer you practice, the fewer tests, and the more appropriate, I believe, the testing often becomes.
That mirrors my practice experience exactly. When I came to naturopathic medical school, I came from a background of being a medical technologist in a laboratory, and I thought lab tests were the answer to, you know, medicine and making the right diagnosis, etc. And the longer I practiced medicine, the clearer I saw that that was absolutely the wrong way to think about it. And then I read an article, now this is probably 15, 20 years ago, a study looking at diagnosis and how do you make an accurate diagnosis. It turned out that this study revealed somewhere around 85 to 90% of what you need to know to make a diagnosis comes from the interview and the history. And perhaps about 7% comes from diagnostic testing of all sorts. And so that's what I preach to my students, and that's how I try to practice, is if you listen to the patient, they will tell you exactly what you need, and you will get, you may still need some targeted testing, but it should be very clear that the answer to this is either going to help me make or rule out a diagnosis, or it's going to alter what I'm going to do for treatment for me to say, yes, I want to order this test. Otherwise, don't order it.